My name is Junya Hatta with FuncPhysio. Today we're talking about cracking our joints. One of the things that we get frequently asked at the physical therapy clinic is it bad to crack my joints? So I want to set the record straight. First and foremost, it's not bad for you. However, cracking our joints is a temporary relief that might be something happening deeper or something of a bigger picture that we might be missing as well. So let's address that first and then we can talk about the cracking. So let's get cracking to talk about cracking. So what is exactly happening when we crack our joints? When we crack our joints, what you're doing is you're releasing gas bubbles back into the bloodstream or back into the body. Sometimes nitrogen, oxygen, carbon dioxide gets trapped in between our joints and forms kind of like a bubble. And once you crack them, you're releasing that back into the bloodstream, back into the body to be reabsorbed. Within 20 to 35 minutes, that'll be completely reabsorbed by the body and you won't be able to crack joints in between that time frame. So the other reason that might be there's some joint popping or cracking might be because of the tendons or ligaments in that joint. Sometimes when we move our body, when optimal motion is not happening, the tendons or ligaments might rub against or go over some certain structures that cause a popping or snapping sound. Although these things are not detrimental to your health, sometimes it can be a little bit annoying and we want to address the actual issue. One of the things about cracking your joints is that they happen in the joints that we don't often use, or maybe for example if we're sedentary, not using them for a while, and all of a sudden we start using them, they may pop a crack. So the sensation that you might feel when you're rotating your body, bending it or twisting it, and all of a sudden feeling a pop is an indication that we haven't been using that body part in a certain range of motion. So for example, let's take one of my favorite places to crack or pop is my lower back. So if I go ahead and move into a certain position that I'm not used to, and then apply a little bit of overpressure, and I hear a crack, it's going to feel good, and I'll be able to move a little bit better in this direction. But it just means that I usually don't move in this direction, and therefore that's why those gas bubbles originally exist. Now, once we move into this position and go a little bit further, it's possible that we may strain or we may cause some issues in our muscles or even the ligaments that's in our body as well. So when we move in new directions or new positions that we're not used to, the body is susceptible to injury. So that's where we want to be careful. So in conclusion, there are no real negative effects of cracking your joints. However, we do want to look at why we crack them in the first place as well. And that'll be where our real issue is. It just means we're not functioning in the areas that we're supposed to be and we're not moving the body to the best of our capacity. By improving our movement, what you're going to notice is that you'll have to crack your back less. You'll feel less of that need or pressure within your body that you'll be like, I really want to crack my back to feel better. Because in of itself, the back should be feeling better, regardless even if you have to crack it or not. So by improving your motion, improving your function, and improving the ability to control your body better will help you have to crack your back, neck, any joint a little bit less. So try these mobility exercises out to help you get a little bit of relief in your mid-back as well as your low back so you won't have to feel like you want to crack these areas anymore. So as I previously mentioned, one of the reasons why we always want to crack our back is because we lack the range of motion. If we're not used to moving our body in certain areas, that's when there's a lot of pressure and those gas bubbles fill. So in order to reduce that likelihood or reduce that want to crack our joints, we got to get the body moving. So the first mobility drill, what's going to be done is called full moon. So what I want you to do is let's go ahead, we're going to lie on our left side first. When we do this, we're going to have our top knee bent and our bottom hand just on the knee here. What this does is it keeps the pelvis stable, locks our low back. Next, what we're going to be doing is using our right hand. It's going to start in front of us and reaching forward. And we're going to go ahead, reach above. And as you can see, as when my hands are turning, so is my head, because I'm continually watching my thumb. And go ahead, reaching back, moving our head. Once again, when the arm comes back up, still looking at the thumb at all times. And we're going to go ahead, keep going around in large circles, 10 times around. Obviously, the slower you go, the more of a stretch you may feel, but just going at a nice comfortable rate here. It may be a little bit tough keeping our knee down, but make sure you hold it down with your top hand. And very good. Always watching the thumb. And once we do this side, make sure you flip over, do the other side as well. Our next exercise, once again working on the mid-back, it's called thread the needle, and all you're going to need is a place to kneel. So we're going to go ahead, have our hands underneath our shoulders and our knees underneath our hips. For this exercise, let's start on the left side. What we're going to do is we're going to take our left hand and put it through the space in between our right hand and right knee. Going here, trying to reach as far as possible, and then coming back up. Once again, we're going to reach across and come back up. Reach across and come back up. And once again, don't forget to do the other side. We're going to reach across and come back up. As you can see for myself, I'm having a much easier time rotating this way. So I lack the thoracic mobility to rotate to the other side. What that does is it's going to promote rotation in the thoracic spine. And once again, rotation is good for our spine. Our next exercise will be a foam roller extensions. We want to make sure we get a foam roller for this one. If you don't have one, please go get one. They're life-changing, and it's not the life-changing that you thought it would be a sham wow or like a Snuggie. This is actually life-changing. So what we're going to be doing is we're just going to go ahead, come up to the area. We're going to be lying down, knees bent, and we're going to place a foam roller right around our mid-back. Now, the most important part about this is making sure we have our pelvis locked in posterior rotation. Sometimes what we want to do is we want to overarch it, and what we're doing is we're not doing spinal extensions anymore. Well, not for our thoracic spine anyways. We'll be doing it for our low back. So as you can see myself moving my hips back and forth, we're going to make sure we just keep this down. And while the pelvis is down, we're going to go ahead, have our hands behind our head, and then what we're going to do is relax into extension here. So as you can see, my pelvis isn't moving, and all that motion is happening at the thoracic spine. Get a good stretch, come back up. Going back down, and come back up. And once again, once we do that area, you can move a little bit down. Same thing, pelvis stays locked. And stretching. Good. You might get a little bit of pops and cracks here. That's perfectly fine. In our everyday life, we're always hunched over a computer, always just hunched over, so our spine doesn't get as much extension as it needs. So make sure you do this one. This one will be awesome for your body. Our next exercise we're going to be doing is called a scorpion. It's going to be for our low back and hips. It's a little bit tricky, so make sure you follow along. So in order to do this exercise, we're going to go ahead once again onto our bed or wherever we're lying down, and we're going to lie face down here. And let's do the right side first. So for this exercise, what we're going to be doing is we're just going to bend our knees, maybe around 90 degrees, maybe a little bit more, a little bit less, whatever you feel comfortable. I try to go around 90. And next, after once we're in this position, we're going to go ahead, lift our hip up, squeezing our glutes and rotating our body slightly, and then come back up. Once again, activate our glutes, rotate our body, and come back up. Some people, they want to go ahead, rotate their entire low body as much as they can. Feel free to do so, but go to the range of motion that you feel comfortable. If you like this video, please remember to like it, share it, also subscribe to our YouTube channel. If you're on social media as well, please make sure you follow us on Instagram and Facebook as well. So my name is Junya Hatta with FuncPhysio, and I'll see you on the next video.